Hello friends, welcome back to my channel Mediastinal 101. Today we'll talk about pneumothorax from the respiratory disorder aspects, the pneumothorax. So before starting the topic in details, let's clarify the terms. What do you mean by pneumothorax? Pneumo means what? Definitely pneumo means the ear, and thorax means in terms of the chest cavity. So if we just make it in the better way, what can we say over here? That whenever we will get the presence of the ear within the pleural cavity, at that time this condition that will be regarded as pneumothorax. Okay, so if we say over here, try to understand. Okay, so if I say over here the presence of ear within the pleural cavity. Okay, this condition is known as pneumothorax. Now see, under normal physiological circumstances, what do you know? Within the pleural cavity there is no ear. So if we see the structures of the pleural cavity, see from here, is the lung parenchyma, is the what? This is the layer, this is the what? Visceral pleura, and the outer this is the what? Parietal pleura. Now what do you know that the visceral pleura, if we see over here, the visceral pleura that is sticky with the what? That is stuck, or that is sticky natures with the lung parenchyma. That is having what? The sticky natures with the lung parenchyma. Okay, let's over here. And whatever the parietal structures that is having the tendency to get stuck with the chest wall. Okay. So anyway, let's draw it. Okay. Please just concentrate over here. That is having the tendency to get stuck within the lung parenchyma. And see, if you talk in terms of the parietal pleural layer, that is having the tendency to get stuck with the chest cavity. So if you see the structures for the the parietal pleural layer, whatever thing will get over here, will get that will get stuck with the pleural, sorry, the chest wall, the what? That will having the tendency to get stuck with the chest cavity. For example, in this way I am showing you guys. Okay. Now see, it is having the tendency to get stuck with the chest wall for the parietal pleura. Okay, I had to draw from first time, so I am so sorry. Thanks for your patience. Anyway, let's continue. Now see, what do you know that in this case, try to understand that the inner pleural layer, that means the visceral pleura, that will get stuck, the sticky natures for this pleural layer that were within the lung parenchyma, and whatever the parietal pleura that will get stuck along with the chest wall. Now within the chest walls is the what? Ribs, and in between them with the red color we can see the intercostal muscles over here. Now what do you know that always we will see that the lungs, they are having the tendency to recoil in. Why? Within the lung we know what, there is a presence of elastic tissue. For the presence of elastic tissue, the lung, they would like to recoil in always. So in this case, if I just show, the lungs are having the tendency to recoil in from all directions. And now see, okay, the lungs are having the tendency to recoil in, and whatever the chest wall or chest cavity, whatever we can see over here, they are having the tendency to expand outward, to bounce outward. So see, as a result, the lungs are having the tendency to recoil in, and the chest wall are having the tendency to recoil or to bounce outside. Okay, as a result, try to understand. It is the lungs is trying to what? The lungs is trying to recoil in, and it is trying to what? Expand out. As a result, we will see in between these two layers, we will get what? The pleural cavity over here. That means within the pleural cavity, we will get the negative pressures. See, it is trying to recoil in, it is trying to what? Expand out. In between these two layers, that means in between the lungs and the chest wall, we are getting the pleural layer over here. So definitely within the pleural, we will get what? Negative interpleural pressures. So for that thing, if we write it over here, so for the tendency of the lungs, so lungs tendency to recoil inward for having what? Elastic nature, for having elastic tissue, we can say. Okay, for having elastic tissue. And what about, okay, it will, its tendency to go inward, okay, the recoiling tendency to go inward. And what about the chest wall? The chest wall, they would love to what, expand outward. So okay, expand out in these directions, for example. As a result, we will get the negative interpleural pressures. We will see the development of the negative intrapleural pressures. So we will get the negative intrapleural pressures over here. Okay. Now see, then what can you see? The pleura that is just doing the balance, the pleural cavity or the pleural layer that is doing the balance, and to just keep together the along with the lungs with the what, chest wall. So the pleural cavity or the pleural layers, they are making the balance in between the what, chest wall and the lungs parenchyma over here. Okay. So they are the pleural cavity, they are keeping together the lung parenchyma or lung, we can say, and the chest wall over here. Now what can you see over here? If we see the actually if we, there is no existence of this space over here, but in terms of, if we see that there will be the presence of the potential space, we will get the potential space in between the chest wall and what, lung parenchyma over here. So within this space we will get what, the presence of the small amount of the lubricating fluid. We will get the presence of what, small amount of the lubricating fluid. So within the pleural layer, that means in between the pleural layers, we will get 10 to 15 ml of lubricating fluid. Now what is the functions for this lubricating fluid? When you see under normal circumstances, you can see that the chest wall and the lung, they can just glide on each other or they can slide on each other. As a result, if the fluid is not over here, there will be too much frictions. So this fluid, the lubricating fluid that is present within the what, within the pleural layer, within the pleural cavity, okay, this fluid that will reduce the frictions whenever they will glide on each other or slide on each other, the what, the chest wall and the lung parenchyma or the lung, we can see over here. Okay, so that will reduce the frictions. Now for any region, if we get, try to understand, if any regions we are getting the presence of the ear, for example, we are getting the presence of the ear where, within the pleural cavity. At that time, see this negative pressures, this negative interpleural pressures, that will be not existed over there. Whenever once the ear that taking entry within the pleural cavity, at that time this negative interpleural pressure that will be not existed over here. At that time, what, if the pressure is not over here, we can say the negative interpleural pressure is not over here, the lung, they will try to what, go inward. As a result, we will get what, the tendency for the collapsing of the lung, that will be increased over here. So the tendency for the collapsing of the lung, that will be increased whenever the ear that will be present over within the pleural cavity. Okay, so if we get, so for having the what, negative interpleural pressures, there is a tendency for the lung expansions during inspirations. But once the ear we are getting, or the gas, we can say, within the pleural cavity, try to understand the negative intrapleural pressures, that will be not there. So whenever we will not get the negative interpleural pressures over here, it will be absence, for example. So in these cases we will get what, the lung collapsing, the tendency for the collapsing of the lungs, that will be increased. So we get lung collapse, the tendency that will be increased over here. Okay, now we'll talk about the different kinds of the causes in terms of the pneumothorax. Okay, before that we can classify, as far as the causes are concerned, we can classify the pneumothorax in the different types. So first I'll talk about in terms of the spontaneous pneumothorax, then I'll go to the traumatic pneumothorax, then I'll talk about the different other types. So first we'll go through the spontaneous pneumothorax. So spontaneous means, in these cases, the pneumothorax that will be done spontaneously for whatever under normal physiological circumstances. We can see this type of thing. For example, I am standing over here, suddenly I can develop the pneumothorax. Okay, so this type of the pneumothorax, that is known as spontaneous pneumothorax. There will be no traumatic any regions. Okay, now let's type them over here. So if I say for the development of the pneumothorax, definitely try to understand for the development of the pneumothorax, definitely the air should come where within the pleural cavity. Now from where the air that will come? One thing the air, try to understand one thing the air that can go from the chest cavity over here. Another thing from the lungs, the air can come over here. So we can say the air that can come where within the pleural cavity from where? The first we can get from the lung to pleural, and another we can get from the chest to pleural. Okay. Now as far as the causes are concerned, we can classify the what pneumothorax in the different types. So first I will talk about in terms of the spontaneous pneumothorax. So we can classify, for example, we will get the spontaneous pneumothorax, and we can get also the traumatic. Traumatic means from the term it's easy to understand. If we get any kind of traumatic regions, for example, this type injury, accident, whatever, where we get the that problem, where we can say the structural problem will get where within the lungs for the having the traumatic incidents. So we can say write it over here, the traumatic spontaneous. So sorry, we can write it over traumatic pneumothorax. Traumatic. I'm writing pneumothorax. Okay, pneumothorax. So first, in these cases, the spontaneous pneumothorax that will be without trauma. And in traumatic pneumothorax that is totally dependent on the trauma. So if we get the trauma, definitely we can get the development for the traumatic pneumothorax. Now see, spontaneous pneumothorax I have already said. Okay. Now the spontaneous pneumothorax that can be developed further in the two types: primary spontaneous pneumothorax and secondary spontaneous pneumothorax. So if you write it over here, the primary spontaneous pneumothorax, and you can classify the secondary spontaneous pneumothorax. Now, how can you differentiate in between the primary spontaneous pneumothorax and secondary spontaneous pneumothorax? See, the primary spontaneous pneumothorax that will be totally without any cause. For example, in these cases there will be no lung disorder, yet the persons can develop, the healthy persons, they can develop the pneumothorax. So without any kind of the lung disorders. But in case of the secondary spontaneous pneumothorax, in these cases we can see the presence of the lung disorders. Okay, in these cases we can get the presence of the lung disorder or the lung disease, for which we will get the development of the secondary spontaneous pneumothorax. So the first thing, primary spontaneous pneumothorax without any without lung disease, and definitely I have already said that it will be without trauma. So if you want to write, you can write it over here, without any kind of the trauma. In these cases, the secondary spontaneous pneumothorax that will be with lung disorders. So in these cases we can get the lung disease. Another thing we can write it over here, it is also what? Without trauma. For example, in these cases, how can we differentiate them? Okay, for example, is a normal lung. Okay, let's so over here. Is the pleural layers. Okay, for example, we are getting for without any lesions or without any kind of the lung disorders or without any kind of the trauma, we are getting the the presence of the ear. For example, over here we are getting the presence of ear within the pleural cavity. Okay, and in these cases, for examples, okay, see, for example, we are getting any kind of the pathological conditions within the lung or the lung disease, for what we are getting the presence of the ear within the pleural cavity. That will just do the development of the pneumothorax over here. Okay. Now the primary spontaneous pneumothorax, where can we see and what are the causes for these things? Let's talk about these things first, then I will go to the secondary spontaneous pneumothorax. Okay, so let's talk about first primary spontaneous pneumothorax. Okay, so I'm just erasing this part. Then I will talk first the primary spontaneous pneumothorax, then I will talk about secondary spontaneous pneumothorax over here. Now see, whenever you're talking in terms of the primary spontaneous pneumothorax, primary spontaneous pneumothorax, pneumothorax. How can you get these things and where you can see this type of the problem? Basically, you can see this type of the problem. We can see the development of the primary spontaneous pneumothorax where in terms of the young male, in terms of young male, young what? Thin and tall male. Definitely, usually will get less than 30 years. In case of less than 30 years, okay. Now, whatever the problem we see this case is, see within this thing that we can see the development of certain types of the blebs. I will just draw it now, then it will be clear for you what are the blebs. See, on the lungs, sometimes we can see the development of the blebs or air containing bubbles. Let's draw it over here. Okay, let's draw. Then, for example, these are the pleural layers. I'll draw it for you guys more clearly. See, sometimes we can see in normal physiological circumstances, we can see the development of this kind of the bubbles over here, and this type of thing is known as bleb. So these are known as what? Bleb. So here we will get the the air. Here we will get the presence of the air molecules over here. So this type of thing that is known as the bleb. This type of thing is known as bleb. Now, if we see for any kind of the chances, if we get the ruptures of this bleb, if we get the rupture of the bleb, whenever we get the rupture of the bleb, okay, rupture of bleb, at that time there is a chances for the air molecules from here they can come where? By rupturing after the restrictions of this one, they will come where? Within the pleural cavity, and then they can cause the pneumothorax over here. So rupture bubbles, after that we will get what? The air within the pleural cavity. So there is one thing. Okay, so that can cause also the primary that is responsible for causing the primary spontaneous pneumothorax. See, there is no development, no pathological condition. It's not pathological conditions. Okay, this is normal thing. Under normal physiological circumstances, we can also see this type of the thing. Now, for any kind of the region, if we see there is a chances for the bleb. We can also get the multiple blebs. For example, we are getting the bleb over here. We can get the bleb over here. Okay, bleb over here. Okay, so we can get the multiple blebs. For example, now one bleb just got destroyed. We are getting the rupture of one bleb. After 6 months, we will get the ruptures of the another bleb. Okay, like this, we'll see the persons will develop slowly what the primary spontaneous pneumothorax over here. So we can get also the multiple blebs over here also. So multiple blebs. Now see, in these cases, if we talk in terms of these blebs, this bleb in one side, okay, let's show this color. See, this bleb in one side, it is surrounded by what? It is surrounded by the lung parenchyma. Another side, this bleb is surrounded by the pleural layers. So this type of the bleb that is known as subpleural, this type of the bleb that is known as subpleural bleb. Subpleural bleb, because another type of the bleb I will talk now, then I think it will be more easier. That's why I said it right now. Okay, let's talk about that one. Okay. Another name for it, we can write. Sometimes we can see the formations of the bleb, for example, over here. So whenever we get the bleb formations over here, that will be surrounded by the two layers of the pleura. So this type of the bleb, we can see what we have to say in terms of the intrapleural bleb. So we can get also the intrapleural bleb. Another kind of the bleb that is also responsible for causing the pneumothorax, but it will not come under the primary spontaneous pneumothorax. Okay, that is known as pulmonary bulla. So what is the pulmonary bulla? We should have the idea regarding pulmonary bulla. What is pulmonary bulla? So pulmonary bulla. What is these things? In these things also we'll get the large air containing bubbles, but whatever thing we'll get over here, try to understand from this figure. Okay. In these cases we'll get Also the air containing large air containing bubbles, large air containing will also get the bubbles over here. But in these cases, these bubbles that will be surrounded by from the all directions, it will be surrounded by the what? Lung parenchymal tissue. In this also the lung parenchymal tissue. Now it will be also covered by the what? It will be also covered by the pleural layers. The fun intending in these cases. Now see this type of the blade that the condition that is known as pulmonary bulla. So this pulmonary bulla is also responsible for causing the pneumothorax, but that will not come under the primary spontaneous pneumothorax. So I think now it's easier for you to differentiate in between the pulmonary bulla and what? Bleb. In terms of the bleb we will get, try to understand, in terms of the bleb we will get, the bleb that will be what? Surrounded by, from one side it will be surrounded by the lung parenchyma tissue, another side it will be surrounded by what? The pleural cavity. In these cases, what type of thing we will get, in terms of the pulmonary bulla we will get the large air containing bubbles that will be surrounded from all directions by the lung parenchyma tissue. So in these cases, let's write it over here. So this large air containing bubbles that will be surrounded by lung parenchyma from both sides. Now whenever we see the rupture of this air bubbles, at that time you can get also the what? Formations or the development of the pneumothorax also. Okay. Now we'll talk about the secondary spontaneous pneumothorax. Now we'll talk about in terms of the secondary spontaneous pneumothorax. Let's try to cover it over here. Let's try. What are the thing we'll get over here? Now if we talk in terms of the secondary spontaneous pneumothorax, I have already explained. In these cases we'll get what? In these cases, okay, let's start first, then I will explain. Secondary spontaneous pneumothorax. Whatever the problem we'll get in these cases, try to understand. As I said earlier, that in these cases we'll get the lung disorders, we'll get the lung disease. Now try to understand for you can see in terms of the all kind of the lung disease that can cause also the what? The secondary spontaneous pneumothorax. But more specifically, if we say whatever the disease we'll get over here, basically we'll get that obstructive lung disorders. We'll get the obstructive lung disorder. Now when you are talking in terms of the obstructive lung disorders, what type of the disease we know? In these cases, try to understand what do we know. In these cases, we'll get first, we'll get the chronic bronchitis. We'll get emphysema. We'll get the emphysema. We can get also what? The bronchiectasis. Along with that, we can write what? The asthma. Let's use this color because the asthma is most important one. I will talk about these things in the subsequent part of the respiratory disorders. Now I have said the secondary spontaneous pneumothorax that can develop for having what? If we see the existence of the lung disease in these cases that can develop the secondary pneumothorax, secondary spontaneous pneumothorax. Among them, I have said whatever the disease, the obstructive lung disorders that can develop the secondary spontaneous pneumothorax. Among them, if we talk in terms of the obstructive lung disease, we will get what? Chronic bronchitis, we will get the emphysema, we will get the bronchiectasis, and we will get the asthma. Now, sometimes it may confuse that what is COPD. COPD, if you talk in terms of the COPD means that will define these two things combining. If we just combine these two things, so if we put these two things, that means the chronic bronchitis and the emphysema that can develop the, or that is actually the what? COPD, chronic obstructive pulmonary disorder. So the disease you can see. Now we'll see whatever the problem we'll see in these cases that can cause this type of the problem. Now, okay, let's draw the different color in the different place. Okay. Now see, when you are talking in this way, when you are talking in terms of the chronic obstructive, we can say the obstructive lung disorders in this case, whatever the problem we'll see, try to understand from this figure. In these cases, when you are talking in terms of the obstructions, we will get the obstructions were within the airways. We will get the obstructions within the airways. So whenever we are getting the obstructions within the airways, try to understand from here. So we are getting the what? Airway obstructions. So whenever we are getting the airway obstructions, whenever the air that will come or go, that will come within the lung, or that will be out from the lungs. Okay, at the time that during the inspirations, expirations, try to understand what will get the resistance within the airway. So the resistance for the airway that will be increased in this case. So we get what? The airway resistance that will be increased. So let's write it over here. We'll get in this cases the airway resistance that will be increased. So whenever we are getting the airway resistance that is increased, definitely we will get whatever the problem during inspiration and expirations. Try to understand what do you know. If I just show this figure from here to here, then try to understand. I'm just showing with one alveoli, then I think it will be easier to understand. See, failures to draw two more. Okay, now see. Whenever the air is coming, definitely for having negative interpleural pressure, the lung that will start expanding. So whenever the lung that is expanding, at that time, see, for example, is the airway. Okay. So whenever it is expanding, try to understand, definitely for stretching property of the lungs, okay, for compliant property of the lungs, this airway that will also what? Expanded, this airway that will also expanded. I'm saying it is having what? It is having the obstruction, yet it will just get expanded. So in this case, we will get what? The oxygen that will come, or the air that will come within the lungs, within the alveoli. From here it will be exchanged by the perfusions, the ventilation process. Now after that, if we get the obstructions, okay, if we get the obstructions, now if I let's say first for the physiological conditions. I just said this is for the physiological condition. In terms of the physiological conditions, for example, there is no lung disorders. At the time, the lungs under normal circumstances, it will get expanded for the presence of the interpleural negative pressures. At that time, along with that, whenever it is expanding, the alveoli or you can say the airway that will also expanded. And whenever the airway that will expand, definitely for the air it will be easier to go within from the external environment within the lungs or the alveoli. Now, whenever it will just deflate during the expirations, so we are getting in terms of what? Inspirations, and whatever thing we'll get in terms of the expirations, try to understand from here. So during expirations, definitely we know the airway that will be narrowing, we'll get the narrowing of the airway. So the airway that will be narrowed over here. So during what? Expirations, for the having the elastic tendency of the lung, we'll get during expiration. During expirations, the lung that will try to collapse, but under normal physiological circumstances, so the pleura that will not let the lungs to get collapsed over here. But see, in these cases, that what? The if we say the radius or the diameters or the space within the airway, that will be less, but it will be able to, try to understand, it will be able to expel out the carbon dioxide. It will be able to expel out the carbon dioxide from here to here. Okay, now let's talk about another thing. Okay, so let's continue. So during expirations, what did I say you? There will be easier for the carbon dioxide. Under normal physiological circumstances, we will get the carbon dioxide that will be expelled out. Okay. Now, when we are talking, is the physiological conditions. Okay, is the physiological conditions. Under normal physiological conditions, we will get this type of thing. Now, think about the pathological conditions. Whenever we are getting the obstructions, whenever we are getting the obstruction, whatever the problem the individual will face over here. So for that thing, I just draw again over here. Okay. Now try to understand, is the alveoli, is the airway. Now I'm just showing the obstructions over here with the black color. For example, I'm getting the obstructions for the development of the obstructive lung disorders. I'm getting the obstructions over here. So whenever I am getting the obstructions, try to understand from this figure. During inspirations, the lung that will get expanded. During expirations, the lung that will get expanded. At that time, whenever it will get expanded, there will be also the stretching within the airways. Whenever you will get the stretching within the airways, definitely it will also try to expand. Then whenever definitely it will expand. At the time, if we say a little bit increase of the diameter of the what, airway. So at that time it will be enough. I think it will be enough what for the oxygen of the air to come within the lungs. But if we say in terms of the expirations, the individual will face much more problem. Whatever the problem, try to understand. So during what inspirations in obstructive lung disorders, inspiration in obstructive lung disease we can say, and whatever the problem the individual will face during expiration, that's the most important thing or most pathetic thing over here. Okay, so okay, let's over here. Definitely we know during expirations, so what the diameter that will be less when the lung is deflating at the time. Okay, now try to understand from here. So if I just show the obstructions over here, now it will tends to okay, very little amount of the space we will see over here. Very little amount of the space within the airways. The resistance will be too much. In this case, see, it was only the obstructed. Whenever it is just trying to come back to the normal positions after the expirations, because of having the pre-existing obstructions over here, the lungs, organs of the airway, they will get collapsed. You can say over here, try to understand these two, the two portions or the two terminals of the airway, they will just fuse with each other. They will get fused with each other for having the obstructions, pre-existing obstructions. At that time, the lung, they will be not able to expel the air out. So as a result, the carbon dioxide that will be not expelled out properly. In these cases, we'll get the carbon dioxide that will be not expelled outside properly. That's why in these cases we'll see the accumulations of, for having the problem in terms of the expirations, problem in terms of the expirations. Try to understand from here, the carbon dioxide is not going out. So we'll see the carbon dioxide that will keep on accumulating over here. As a result, we'll see the size of the, the presence of the carbon dioxide that will be increased over here. And we can say in terms of the gas or air, whatever you can say, whenever it is just getting, accumulated within the alveoli over here, definitely the size of the alveoli that will also increase. That's why, in case of the obstructive lung disease disorder, the individuals, they are having the barrel-shaped chest. They are having the what? Barrel-shaped chest. We can say the barrel lungs also. Okay. So you can say over here the barrel lungs, barrel lung or chest, whatever you can say over here. Now what is the problem in terms of the pneumothorax? Now I'll just talk in details now. Try to understand from here. For example, we are getting the any kind of the bubble or the alveoli that is towards the what? Pleural cavity, or you can say the parietal, the visceral pleura. At that time, if we see, okay, let's, so over here, I think it will be easier for you to understand. See, we are getting the alveolar structures over here. Now see, whenever we are talking in terms of the obstructions over here, see, obstructions over here, at that time, the carbon dioxide that will be not able to expel out properly, so we will get the accumulations of the what? Gas. The pressure within the alveoli that will be much more. So whenever the pressure that will be much more, definitely try to understand from here the size of the alveolar, that will also much more, and that can touch also the pleural cavity also from here, the visceral pleura. At the time, whenever the pressure that will keep on increasing at a time, we'll see there is a chances for the rupture of the what? Alveoli. So in this case, we will get the rupture of the alveoli. So whenever we will get the rupture of alveoli. Why you are getting the rupture of the alveoli? Because of having the obstructions, the amount of the carbon dioxide or the expelled air that is getting accumulated over within the alveoli. So in these cases, we will get the carbon dioxide or the gases, we can say, that will be accumulated within the alveoli. So whenever we will get the alveoli, the size of the alveoli that will be increased, size of alveoli that will be increased. So whenever it will be increased, so there is a chances for these things to get ruptures, and whenever it will be ruptures, at the time the air from these portions, the air that will come within the pleural cavity, and that can cause also the pneumothorax, and that will be responsible for causing the pneumothorax. So this was all about in terms of the secondary, spontaneous pneumothorax. In the next part of the videos, we'll talk about in details about the, the traumatic pneumothorax. So this was all about the pneumothorax. In the pneumothorax, I said the two types. We'll get the primary spontaneous pneumothorax. We'll get the secondary spontaneous pneumothorax. And I said also what I also said, separately we'll get the traumatic pneumothorax. In terms of the primary pneumothorax, we'll get it without what? Without trauma. And whenever we divided the primary spontaneous pneumothorax, the spontaneous pneumothorax in two types, the primary spontaneous pneumothorax and the secondary spontaneous pneumothorax. I said the primary spontaneous pneumothorax in this case will not get any kind of the lung disorders. Okay, that can be under normal physiological circumstances. In that cases, I just mentioned about what there may be chances for the formations of the bleb or the pulmonary bulla. Okay. And in terms of the secondary spontaneous pneumothorax, I said there is the chances if we get any kind of the lung disorder, especially I just mentioned about the obstructive lung disorders. Here I did mention about the what? Chronic bronchitis, emphysema, or the bronchitis or the asthma. In these cases, we will get the obstructions within the airway. So whenever we will get the obstruction within the airway, the resistance within the airway for the airflow that will be increased, especially in terms of the expirations. So whenever the problem will be in terms of the expirations, at that time we will get what? The accumulations of the air or the gases within the alveoli. So as a result, the size of the alveoli that will be increased, the pressure within the alveoli that will be increased. So if we get any kind of the alveoli that is nearer to the what? Nearer to the pleural cavity, at the time you can get the rupture of the alveoli, and from the alveoli the air or the gases that we leaked out where that will be leaked within the pleural cavity, and that will develop the secondary spontaneous pneumothorax. Okay, so this was all about in terms of the pneumothorax pattern. In the second part, we will talk about especially the traumatic pneumothorax. Okay, so thanks for watching. If you don't get any point regarding this video, please let me know in the comment sections. I'll be there to help you guys. Okay, thanks for watching.